Greetings, it's Dr. Fisher with Road to Wellness, bringing you some more information on your journey to be well. Let's talk about today diabetes mellitus or type 2 diabetes. They're usually used interchangeably, but let's talk about what that is. And diabetes is when there is an increased influx of sugar running around in your blood vessels. Okay. Your pancreas has a responsibility to excrete insulin into the bloodstream to allow the cells to open up and uptake the glucose. But when that doesn't happen and the glucose is just running around in the bloodstream, we have a problem. That's when you end up being diagnosed with diabetes mellitus. And the way you know if that truly is what it is, experiencing symptoms such as you're thirsty all the time, you're having to go to the bathroom all the time, and you're hungry all the time. So increased thirst, increased urination, increased hunger are the three classic signs to go get tested for your hemoglobin A1C. One of the other things that's very important, because we need to understand what some of the complications are with diabetes. If you're not sleeping well at night, if you're experiencing neuropathy, which means you have some numbness and tingling that's going on in your feet and in your fingers and your hands, if your vision is changing, which means some things are starting to look a little bit more blurry to you, you really, really want to have that hemoglobin A1C again checked. With guys, if you're having issues with an erection being firm or being able to maintain stamina with your loved one, then I'm going to suggest you consider having a hemoglobin A1C done, because that's one of the biggest side effects. So I highly encourage you to stay on top of this, because it's no way to live your quality of life going forward. So Dr. Fisher, Road to Wellness, and I want to make a difference in your life naturally.